So, can you elaborate on what makes a patient a good candidate versus a poor candidate versus someone who you would not do an operation
Yeah.
on at all?
Okay, doctor. See, basically, good candidates are, see, we are relocating hair follicles from back of the scalp to the front. So, good candidates are those whose donor areas are good quality, thick hair. One, two, three, four follicle hair. Okay. So, thick hair, more follicles per graft, great candidate who is not thinning out hair and is maintaining the hair. Because I'm just putting that here.
Okay.
So, one patient may have poor quality hair, good quality hair, very good quality hair. So, number one is good quality hair, good candidate. Point number one. Point number two, if you are also losing it here, it's called DUPA, diffuse and pattern alopecia.
Okay.
So apart from here, unfortunately getting affected here, father, grandfather, somebody has given you a gene. It's creating havoc. So in most of the places, it may create havoc here, wherever. Okay, but in some, unfortunately, the havoc is here also. That's called DUPA. So those are not a great candidate. And if they want to do, maybe they want to get married, they want to have a party, something. So okay, we tell them we are planting it as per your choice, but we have no idea how long they're going to last.
Okay.
So DUPA, if you're losing it here, some people have receding, uh, receding from the back also. So retrograde alopecia. So even this neck here, and they are not just losing from here, they also started losing going up, retrograde alopecia. So they are not a good candidate. This was about the quality of the hair. Now on the scalp. So if you have some dandruff, some boils, okay, we will handle it and correct you. But unfortunately, if you're having scarring alopecia, it's sort of a autoimmune diseases, or if you have psoriasis,
Okay.
if you have alopecia areata, if you have pseudopelade, if you have LPP. So scarrings means your body is killing your hair follicles. So somebody is killing the hair follicles.
Okay.
Why should I take out and put it in? Never know. Some doctors may do after stabilize for 6 months, 1 year. They may do a patch test and see whether it works or not. But we don't do too much into scarring alopecias. And of course, if a burn scar, injury scar, that's different because the process is not continuous. But if somebody is killing your skin over here, the scalp tissue, as the hair follicle, so we are not interested. Yes, if it's stable, you can do a patch test. If it works, then you can do more, but don't do suddenly. Okay. So this was if some problem is here. Now physiological. See, some people may do, but we don't do cardiac cases.
Okay.
Because in cardiac cases, you're having clopidogrel, aspirin, your blood is thin. 4 days I have to stop the hair, the thinners. Then during the bleed, I cannot take anything. I don't have an ICU. So if somebody is doing a hospital setup, cardiologist with them, and it's very, very seriously required, then okay, we might do. Otherwise, normally in a daycare setup, it's not advisable unless you have anesthetist full time, you have cardiologist full time, because if bleeding occurs, what do I do? Because he's also a cardiac case and also bleeding. Okay. And number two is diabetes should be controlled, because the diabetic people have a problem of healing. Their vessels endothelium has an issue of penetration, giving oxygenation. So diabetic patients, the HbA1c should be around 6. Some people do around 6.4, 6.5. We wanted around 6, 6.1, 6.2. Then we might do fasting post-lunch sugar. We do the TMT stress test and all other investigations to make sure the patient is perfect. And in diabetes, we don't do 5,000 grams. We'll do 1 day session of 2,500. We'll call them next month and do 2.5. So we don't want to put so much injury onto the scalp in a diabetic patient. Let it heal 1 day session. And we can always do next month, the second day. So once it is healed. So the issue with diabetes is we don't want any infection, we don't want any necrosis, and we don't want poor growth. Then if you have blood pressure, no problem. You will, maintain the blood pressure and then do it. Then happens is a lot of people, HIV, antigen, HCV positive patients don't do because healing issue, infection issue, So I believe it's a cosmetic thing. Why somebody should be bothered about? They should focus more on the illness, because there are hair patches, there are scalp macropigmentation, other things they can go to rather than a hair transplant.
Okay.
Then we have, if you are having, epilepsy, seizures. So, it has to be controlled. But again, I would like to do an ICU setup. Anytime he has convulsions, local anesthesia, something goes wrong, bronchospasm, what to do. So I would like to do these cases only in a hospital setup. I personally don't take up seizure patients. Some doctors may take, but I would advise it is always better to do an ICU setup. Then if you have too much asthma, I will take, if it's mild, PFT is done, chest physician is given okay. I will keep my anesthetist with me for a respiratory support if at all needed. But again, it should be done in a hospital setup. If somebody has severe asthma, PFTs has to be checked. A little bit is okay, because we also have mini ventilators. We also have all the drips and all for bronchodilation, and we also have all the inhalers and everything. And of course, we have critical care physicians with us. Then happens is If you are having, keloid tendencies,
Okay.
if your scar doesn't heal properly, they overheal it. So hypertrophic scars. So if I want to punch it, I don't want to, or especially in black patients, because they have more chances of getting keloids. So we are a little careful. So we ask them, do you have injury anywhere else? We check their scars. Otherwise, if we do a patch test, we use a smaller size punch, and we are going to use a patch test and check it out for 3-4 months. If it's okay, no scar form, then we can do.
Okay.
Okay. Otherwise, no. Then happens is if you are having, some autoimmune disorders where you are, so rarely we have seen, hair follicle getting rejected by your own self, although their own hair. So if somebody has an autoimmune disorder, I do take an opinion of the autoimmune expert, So because I have seen 1 or 2 cases where their own graft hair follicle get rejected. It may not be there in many scientific journals, but we have seen 2 cases. And there are 14, 15 doctors have researched into it. The conclusion was that, yeah, it has been rejected. Okay. Because we did a transplant here. Why should a swelling come here? Sterile swelling, came somewhere else. So we did linear probe sonographies and a combination of plastic surgeon, dermatologist, autoimmune experts, allergic experts, radiologists. We worked together, did the biopsies, and came to this conclusion: कि rare of rare, yes, your own hair follicle sometimes can get rejected. Sometimes hair follicle breaks, keratin comes. That is that they take it as a foreign body. So if somebody has a medical issues which is serious enough, so somebody has got a kidney transplant, he's immunosuppressed, although we have done on him, we have done somebody else here on him,
Okay.
on a kidney transplant patient, because he's already on immunosuppressant. So we did an HLA typing, blood and other matchings and typings and all.
Interesting.
So as a research paper, we did it with patient's consent, and those hair grew. But normally we avoid because the patient is on immunosuppressant, chances of infection is high. So these are some total contraindications, some relative contraindications, and in most of the cases, the technology has improved so much that we can give them, a new look and feel better, because most of these guys are on 20 to 35. And there's a time they are attracting the opposite sex. They want to have marriages. This is the best time. See, 40, after 14, they lose, they don't mind,
Yeah.
unless they are planning second marriage. Okay. But 20 to 35, I sympathize with them. If I did not have hair in 20 to 35,
Right.
what would be my mental state? I understand.
Right.
So we call ourselves the wedding clinic. Anagen and the Optimums are the wedding destinations. Planning for a marriage in America, visit Dr. Sonau. In Mumbai, come to us. So we prepare you for your marriage. We make you happy. Of course, you got to be fit for that. Okay, doctor?